Okay, so my doctor put me on a drug called Abilify. Um, it's supposed to be an antipsychotic. People are saying it's an antidepressant or whatever. Been on it for a few days now, and I'm having a little bit of side effects. The first time I took it, I was extremely tired. That didn't last very long, and so I decided to take it at night to help me sleep. And didn't make me tired anymore, and I couldn't sleep. He also gave me another pill to help me sleep, Remeron. Uh, Now, I don't want to take that because it will make you gain like 100 pounds in like 2 weeks. So I'm not gonna be doing that. I had issues with those things before. So, but the Abilify, it's making my body hurt. Like I have the flu, and I don't like that, and I hope it goes away. But I'm only on a low dose of the Abilify, so uh, I'm not sure if it's the right drug for me. And I've heard a lot of people saying that they don't like it because of the side effects, and that it's the worst drug out there. It's the last resort for doctors, to prescribe it to patients. And I kind of agree with that. You know, it's not the best drug in the world, and I don't think I need an antipsychotic because I'm not psychotic. But then again, it does work for other, off-label, things. So I'm just hoping that it will soon kick in and work for me. But it is making me a little sluggish. Not tired that I can go to sleep on it, but it is making me like lethargic, sort of, not wanting to do anything. And you know, before I was off this stuff. I wasn't on it. I didn't do anything, and I wanted something so I can, get outside and do things, and interact with people. But the drug is just make me not want to even more. So what the hell is the sense of taking it? You know what I mean? Uh, I don't know. It's not a very good drug. No, I don't think it is. So that's just me. I don't really know what I have. They haven't really diagnosed me that good yet. I mean, they've said, generalized anxiety, borderline personality disorder traits, depression, obviously, paranoia, major paranoia. So I don't really know exactly what my illness is. So, and I wish they'd tell me, but they're just not telling me. Um, I usually, go on medication and then go off of it. That's my problem. I take it for maybe a week or so, or more, and then just go off at cold turkey. I have a problem with that for some reason. I wanted to go back on Xanax. I was on Xanax before. I messed that up. Um, I I said to the doctor that smoking decreases the effects, which it does for me when I took the Xanax. But the Xanax did work. I know it's a benzo, and you're not supposed to be on it for a long period of time because eventually it will stop working. But I was on that for quite a long time, and it didn't stop working for me. It worked. It made me happy. It made me, want to go outside of the house and interact with people, and not have that anxious feeling and, scared people, basically. And I really wanted to go back on that, but I'm not going to be able to because they're scared of putting me on a benzo because of all, the overdoses and everything that I have done on benzos. But Xanax, I've never overdosed on Xanax, and I don't think they're going to believe me. Xanax is like a Hollywood drug, you know, um, and they're probably just thinking that I want it just to get high. That's not the case. I want it because it made me feel better. That's what it. I mean, I can talk till I'm blue in the face to my doctor, and he's not gonna put me on it because he's just gonna think that I want to get high, and that's all I want. I don't really want to be on any psychotic. I've been on them before, and they've made me really fat, and there's been a hell of a lot of side effects with them. I'm scared of them. I've been on a lot, and the worst one I think is Seroquel. I've been on a very very high dose of that back years ago, and it gave me horrible horrible side effects. and I believe they were seizures, very weird seizures, but they were seizures, and they kept feeding me. I was in the hospital this time, but they kept feeding me Ativan, and it didn't help at all, because they thought it was an anxiety attack. Now, anxiety attacks, anybody who has anxiety attacks know what they are, know what they feel like, and know what they do to your body. Now, what I was having was my eyes were rolling back in my head, and my neck was extending to the point where I thought it was going to break off, and it would go on for hours, and they kept feeding me Ativan, and it didn't work. And they said, oh, it's anxiety attacks. And my ass, it was not anxiety attacks. It was some sort of seizure, because they had me on, like, the highest dose of Seroquel, an antipsychotic. And I don't want to be on them, so I think that, I'll give it a couple more days with this Abilify, but if the body aches keep up and I can't sleep because I don't want to take that damn Remeron. I don't want to gain 100 pounds in 2 weeks. I don't want to do that. I need to lose it. I need a medication that will decrease my appetite, make me lose weight, because, I'd rather be skinny and depressed than fat and happy, basically. Yeah, so I'll just give it a while, and then if it keeps doing what it's doing, then I'm going off of it. I don't know. I think most people are right, on YouTube. People are talking about Abilify. They're right, I'm thinking. So, I'll just see. Alright.